Hello students, continuing with the topic of seizures or epilepsy. This is the third in the series of epilepsy. Previously I discussed in the part 1 the various classifications of seizures, and in part 2 I discussed about simple partial seizures. Today I will be taking up part 3, in which the topic will be generalized seizures. Generalized Now, what are generalized seizures? Just write down: when bilateral cerebral dysfunction occurs associated with EEG changes. Bilateral cerebral dysfunction occurs associated with EEG changes. EEG means electroencephalographic changes, and without any detectable focal onset. So such type of presentation of epilepsy is labeled as generalized seizures. Now it has following types as per the classification I discussed. First one is absence seizures. In the generalized seizures, first one is absence seizures, also known as Petitmal epilepsy. Also known as Petitmal epilepsy. As I told you earlier, this T is silent here, so it is known as Petitmal epilepsy. It is further of two types: typical and atypical. This Petitmal seizure is of two types, that is typical and atypical. Now taking up first typical absence seizures or Petitmal seizures, write down various features. It is almost always idiopathic in nature. It is almost always idiopathic. That means we are not able to find out the cause even after getting all the investigations like CT scan, MRI, etc. So it is almost always idiopathic. There is sudden, next time we go, sudden brief spells of unconsciousness, multiple in nature during the daytime. No loss of postural control. There is no loss of posture control. पेशेंट बैठे बैठे ही एकदम उसको एब्सेंस होगा, ऐसे जैसे लगेगा कि ही इज जस्ट लुकिंग एंड जस्ट ऑल. So no loss of posture control, that means he will not have a fall. No post-ictal phenomenon. Post-ictal phenomenon means after the attack there is some period which is known as post-ictal period. During this period of recovery. So in this typical Petitmal epilepsy, there is no post-ictal phenomenon. Age of onset is 4 to 8 years or early adolescence. 4 to 8 years or early adolescence. That means 18-20 years. It's a sort of daydreaming. जैसे हम स्कूल में क्लास में बैठे हैं तो टीचर कहते हैं क्या सोच रहे हो आप, पेशेंट ऐसे देखता है और देखते रहता है बच्चा जो 4 to 8 years. Daydreaming, sudden stare in the sky or space, rolling up of eyeballs. जो eyeballs हैं, these are eyeballs. This is eyeball. This will start roll upward. This will go upward. This is called rolling up of eyeballs. From this phenomenon, the teacher or the onlooker can understand that this person has got some abnormal nervous system disease. So rolling up of eyeballs and fails to respond to verbal commands. उस टाइम अगर हम पेशेंट को हिला के पूछे में क्या बात है, क्या ऐसे क्यों कर रहे हो, he will not be able to follow the verbal commands. They are often associated with generalized tonic-clonic seizures but have no neurological disease. उनका हम फाइंड आउट करें सीटी स्कैन MRI में कोई फाइंडिंग नहीं आएगी, परंतु समटाइम्स दे आर एसोसिएटेड विद इन लेटर स्टेज generalized tonic-clonic seizures. There is no neurological deficit and EEG. Very important point in this disease is the finding in EEG. The EEG is diagnostic. It is 3 spike wave pattern. EEG is diagnostic, 3 hertz per second. It is known as 3 spike wave per 3 spike wave pattern or 3 hertz per second spike wave pattern. This disease, since it is seen in early childhood, it leads to poor school performance in the studies. So this type of disease, that is typical absence seizures or typical Petitmal seizures. So this is first type of Petitmal. Second type is atypical Petitmal or atypical absence seizures. In the atypical absence seizures, the longer lapse of consciousness is there. In that typical, there is very short span of unconsciousness which we are not able to even follow it up. Whereas in atypical absence seizures, there is longer lapse of consciousness. Next line में लिखो less abrupt in onset and causation. In typical it is sudden, एकदम हुआ ठीक हो गया, एकदम हुआ multiple times it occurs. Whereas this type atypical, it is less abrupt in onset and causation. Focal or lateralizing signs may be present. Focal signs, as I told you, in focal simple motor seizures like angle of the mouth, this thumb and great toe, they may start with this also. So that lateralizing sign may be present. In the next line, let down associated with signs of neurological dysfunction. They may show signs of neurological dysfunctions like motor system involvement, sensory system involvement, cerebellar, etc. And EEG is, here it is 3 Hz spike per second spike wave pattern, here it is 2.5 Hz per second spike wave pattern. So this is the difference between the EEG of these two conditions, typical and atypical. In typical it is 3 Hz spike per second spike and wave pattern. Here it is 2.5 per second spike and wave pattern. So this is regarding first type of generalized seizure, that is Petitmal or absent seizure. It has two types, typical and atypical. Now coming to the second, which is most commonly observed, that is generalized tonic-clonic scissors. Generalized tonic-clonic scissors, also known as Grandmal epilepsy. This is the commonest one which is observed in the society. So write down, it is a main seizure type and seen in 10% of all epileptics. So incidence is, it is main seizure type and seen in 10% of all epileptics. It has the following phases. Number one, it has following phases. Number one is prodromal phase. Number two, tonic phase. Number three, clonic phase. And number four, post-ictal or period of recovery. So these are four phases of Grandmal epilepsy: prodromal phase, tonic phase, clonic phase and post-ictal phase. Total duration of one attack may be up to 2 minutes, maximum 2 minutes. All these things take 2 minutes. Now first, prodromal phase. In the prodromal phase, before the onset of attack, a period of few hours may be present of increased irritability. जिसको अटैक होने से पहले, कुछ घंटे पहले पेशेंट को क्या होता है, इरिटेबिलिटी, इंक्रीज्ड इरिटेबिलिटी, चिड़चिड़ापन जिसे हम कहते हैं, वैसे उसको शुरू हो जाता है. एंड पीरियड ऑफ अनईजीनेस, दैट मीन्स पेशेंट जो है कुछ समय पहले वो अनईजी एंड इरिटेबल बिहेवियर शो करना शुरू कर देता है. एंड सेकेंड, नेक्स्ट लाइन में लिखो, देयर मे बी फेज ऑफ ऑरा, दैट मीन्स features of simple partial seizure may be present. As I told you, in the simple partial motor seizure or sensory, there may be period of aura which may convert into generalized seizure. So that aura may be there. So this is called prodromal phase. Second phase is tonic phase. In the tonic phase, there the whole body of the patient becomes stiff and board like because of total muscle spasm. सारी बॉडी का स्पैज्म हो जाता है और जो बॉडी होती है पेशेंट की, इट बिकम्स लाइक दिस, स्ट्रेटन. सपोज दिस इज द बॉडी ऑफ द पेशेंट head, neck, arm, trunk, legs. Now this whole body gets straightened, stiff. So whole body gets stiff like board due to intense spasm of the skeletal muscles, and because of this there is also spasm of the intercostal muscles and respiratory muscles, leading to cyanosis because of asphyxia. So cyanosis, asphyxia, stiffness of body like board, and this period remains for 10 to 30 seconds. This tonic period remains for 10 to 30 seconds. Immediately followed by during this period tongue bite, जीभ कट जाती है पेशेंट, tongue bite. So in the tonic phase, to recollect, first is straightening stiffness of the whole body because of intense muscle spasm of the skeletal muscles like a board. Then because of spasm of the respiratory muscles there occurs asphyxia and cyanosis, and there may be later on tongue bite, because जब वो पेशेंट एकदम अकड़ जाता है तो जीभ जहाँ दांतों के बीच में आ गई तो ऐसे ही आ गई, that leads to tongue bite. This phase remains for 10 to 30 seconds, followed by the third phase, that is clonic phase. Clonic phase is also known as jerky phase. It is known as jerky movement phase. During this phase, after the tonic phase, the patient's body starts jerky movements. Whole of the body starts jerky movements like this. They are very violent and this movement can injure the body. अगर पेशेंट बैठा हुआ है, लेटा हुआ है, वो एकदम स्टिफ होके गिर जाता है और फिर उसके बाद जो क्लॉनिक फेज में उसके ऐसे ऐसे टांगे और हाथ ऐसे ऐसे जर्की मूवमेंट्स करते हैं, वो कहीं भी लग सकते हैं. सो दिस जर्की मूवमेंट्स, it is violent, face, hands and limbs. Tongue bite may also further deepen and there may be incontinence of feces and urine. पेशेंट का पेशाब और टॉयलेट लैट्रिन भी निकल सकती है बिकॉज ऑफ नो कंट्रोल ओवर द स्फिंक्टर्स. Incontinence of urine and feces during the phase of clonic movements, that is jerky movements. During this phase, jerky movements के phase में patient फिर एकदम गिर जाता है बॉडी नीचे जमीन पे और it may lead to various injuries to the body, head injury, brain injury, face injury, body injury, fractures, etc. This phase lasts for less than 1 minute. This phase, that is clonic phase, is followed by phase of postictal or period of recovery. During this postictal phase, the patient remains confused. क्या कह सकता है? Confused, semi-conscious, drowsy, or even unconscious for some times. Later on, when he gets the consciousness level back, he may feel headache, heaviness of head, body aches, pains, fatigue, etc. So in the post-ictal phase, patient after having the attack becomes unconscious or remains confused if he gets the consciousness, drowsy, and there may be headache, myalgias, fatigue, and this period remains for few minutes to several hours. ये टाइम काफ़ी लंबा भी हो सकता है डिपेंडिंग ऑन द severity of attack. And the EEG is very helpful in diagnosing Grandmal epilepsy. So EEG is helpful in diagnosis. Helpful. So this is regarding generalized scissors, tonic-clonic scissors, that is Grandmal epilepsy. Then coming to the third part of the generalized scissors during the classification, first was absence scissor, that is Petitmal, Grandmal. Now third is Atonic scissors. It is not very common. Atonic scissors. In this scissor, there is sudden loss of postural tone of the muscles leading to fall. Just like in Grandmal epilepsy, in the phase of tonic convulsions, this type of areas also there is loss of control of the muscles leading to fall, and this remains for 1 to 2 seconds. There may be brief impairment of consciousness, but there is no post-ictal phenomenon, and EEG is specific for diagnosis. So in this it is a fall. In tonic phase, there is sudden tonic contraction of the body gets, then the fourth type atonic के बाद tonic. During this sudden tonic contraction of the muscles of the body, in this there is sudden fall, loss of tone. That is why it is called atonic. In this tonic, there is sudden stiffness of the body. Sudden stiffness of the body due to increased contraction of the skeletal muscles with flexion of the arms and extension of the legs. ऐसे हो जाएगा. ऐसे कर. This type of posture will be there. So it is tonic type. It remains for 10 to 30 seconds. Consciousness remains preserved. The EEG may be helpful. So this is fourth type of generalized seizure. Atonic third, fourth tonic, and fifth one is myoclonic scissors. This is in the generalized scissors. Look for the classification. In the classification, part 2, generalized scissors. Number 1 was Petitmal, number 2 Grandmal, number 3 tonic, atonic, number 4 tonic, then myoclonic. Fifth one. In the myoclonic scissors, there is sudden and brief muscle contraction involving one part of the body or entire body. Sudden, brief contraction of one or whole of the body. It is usually seen in patients of metabolic disorders like uremia, then hepatic encephalopathy and electrolyte imbalance. So किन डिजीज में कॉमनली देखा जाता है? यूरेमिया, that means chronic kidney disease, uremia. Then number 2, hepatic encephalopathy, that means raised bilirubin levels leading to brain dysfunction. And third one is electrolyte imbalance. So in these conditions there may be myoclonic scissors. There is uncommon condition like degenerative brain disorders, Alzheimer's disease. This disease, Alzheimer, may also have myoclonic scissors. Alzheimer is senile, pre-senile brain degeneration. So in these conditions, that is uremia, hepatic encephalopathy, electrolyte imbalance, degenerative brain disease like Alzheimer's, this type of sudden jerky contractions of one part of the body or whole of the body may be seen. These jerky movements are very violent and they may injure the body. So this is myoclonic scissors. So this completes the second part of epilepsy, that is generalized scissors. Now coming to the third variety as per the classification by International League Against Epilepsy, that is unclassified scissors. That means we can't group in any of the above classification. So first one is neonatal spasm. In this neonatal spasm, it occurs in the first month of birth and most commonly due to some brain injury or certain diseases, congenital disease of the brain. So this is neonatal spasm or seizures. Second is infantile spasm. In the infantile spasm that occurs after 1 month of age of the child, this spasm occurs in infants due to various metabolic conditions like hypocalcemia and high grade fever. Hypocalcemia and high grade fever. So this is neonatal seizures, you can write infantile spasm. It occurs in hypocalcemia and high grade fever. Neonatal spasms occurs due to various brain diseases in the first month of the age of the child. So with this, the description of various types of epilepsy is finished. So this is in the part 3 of epilepsy. So please continue to look for all the 3, part 1, part 2, part 3 so as to remain in continuation. Go on to subscribe my app from the store, Android app store, Play Store, There is my app. I will give the address also in this app, in this video, and please may give any comments, any queries in the comment section. Go on properly reading the books also. Thank you.